Hello, I want to take a moment to discuss about different therapy modalities. A lot of times, the when you're becoming a nurse practitioner, your focus is on medications and medication approaches. You may not do a lot of therapy in even if you work in inpatient or even in outpatient, you may do some brief interventions, but not full-scale therapy. You may not get involved in, but it would be a good idea to learn about them. Two things. One is like you may have to interact with a therapist. You may have to refer to a therapist and recommend. I think that this kind of therapy will be good for the patient. And from a board licensing standpoint, all these therapies will be asked in the exam. So you want to know about all of them. So let's go through each one of them and see what we can learn about it. So each therapy has its own strengths and weaknesses. It has its own modality. And because of its unique principles and techniques, it can be used in different things. Like when you think about cognitive therapy focuses on thoughts, feelings, and behaviors and their relationship. Its aim is to challenge and change distorted thoughts or beliefs. Then you can help identify somebody, the negative thoughts and dysfunctional thinking patterns, and you can help them to replace those unhelpful thoughts with more balanced and constructive ones. So in this one, you can use journaling, where writing exercises help them to identify triggers and pattern of thought and things like that. So, for example, treating depression and anxiety by teaching individuals to shift from negative self-talk into constructive thoughts. So that's cognitive therapy. Now let's come to DBT. DBT, you will hear about it because it's very much used in borderline personality disorder. It was created by Marsha Linehan. And the core principle is that you're helping managing intense emotion without restoring to harmful behaviors. And you also help clients improve relationship by asserting needs and setting boundaries in the relationship, and reduce the risk behavior also, like suicidal ideation and self-harm risk also. DBT combines mindfulness and skills training to help individuals develop a balance between emotion and logic. So think about DBT, think about borderline personality disorder. Now let's think about existential therapy. Now in this therapy, it explores meaning of life, where somebody is facing existential dilemmas such as freedom, responsibility, life, mortality, and things like that. So in this, you're thinking about individuals' capacity to choose and shape their life despite challenges. And it also supports clients who have like career changes, aging, grief, and things like that. And then terminal illness, where you're helping individuals find meaning and acceptance in the face of mortality. Often used in client experiencing grief, guiding them to live through that. Okay. Now, humanistic therapy, it's rooted in the work of Carl Rogers. Carl Rogers was the one who did this work. And then here you're thinking about self actualization, or means like capacity of growth and self improvement and fulfillment, coming to your full potential. So provide the therapist provides a unconditional positive regard, empathy, and genuine support, and encourages the individual to achieve their fullest potential and personal development. So improving self-esteem, this is what humanistic plays a role. Now let's talk about interpersonal. This one is a short term, always time limited, structured approach where you're working on interpersonal problems like family relationship or supportive relationship and life changes, any life changes. It's used to treat depression triggered by relationship difficulties, or life changes. Now, you also want to think about EMDR. EMDR is used in PTSD. It focuses on resolving trauma-related memories and symptoms. The eye movements are used to desensitize distressing memories and helps clients integrate traumatic experiences into their narrative. And it helps in decreasing the emotional and psychological distress. Let's think about family systems therapy. Here, it's mainly family dynamics and relationships, how conflict and stress is managed between three people in a family system, and families set healthy emotional and relationship boundaries, and it clarifies role and authority within a family structure. An example is effective in addressing family conflict, parenting issues, and intergenerational trauma. So that's family system. In this, genograms are used to think about that. Biofeedback. Here, it's technology is used to teach self-regulation of physiological process, like in panic attacks or things like that. So it tracks physiological monitoring would be it tracks physical responses such as heart rate and muscle tension, and use real-time feedback to control body responses and body positioning, used in panic attacks and anxiety disorders and pain conditions. Okay, so hope that this helps to give you an idea of like all the different things. So we got cognitive therapy, DBT, existential, humanistic, interpersonal, EMDR, family systems, and biofeedback. Thank you very much.